bit about the Ebola virus? Because we've had Hollywood, come out with movies like Outbreak, and people are probably going, this is going to be like a zombie invasion. This is Hollywood, but what exactly are we dealing with when we say the Ebola virus?
Well, it's a virus which has largely been confined to tropical Africa in several different countries. It's a virus in a category called hemorrhagic fever viruses, which has historically appeared in small outbreaks in rural areas, and then it has burned itself out in a short span of time. It has a lot of intense human-to-human transmission around the time of the outbreak, and then it's controlled, and then it'll disappear for sometimes even a decade or more. Then it'll just reappear somewhere else. The reservoir is presumably in some fruit bats or some other small mammals.
Mm-hmm. And so we're thinking possibly it's contracted from like a bat or like a rat or something like that?
Right. Probably the contact, it's often hard to know which is the index case, the number one case, but oftentimes it has been associated with contact with a bat or with a non-human primate, because apes, chimpanzees, they can get it as well, and then sometimes if somebody catches one or slaughters one or something, they can get infected that way too.
The biggest question we get from people is how do we get this? And that's a huge fear for people, especially now that we've got one patient from West Africa who's now here in Atlanta. People go, that's 2.5 hours away.
Mm-hmm.
How do we contract something like this? Is it real hard to do? Is it easy to do?
Well, I think so. The transmission has all occurred in Africa. There's not been transmission of the disease here in the United States. As you know, the physician who got it as well as the other worker were both heavily exposed to Ebola patients. It's felt to be contracted through blood, body fluid, secretions, and pretty much any kind of secretion or body fluid contains the virus. And so if somebody's in enough contact with that and it potentially skin or mucous membrane exposure, which is like mouth, nose, eyes, as well as in some hospital outbreaks in Africa, there's probably been some reusing of needles and things, which has also continued to fuel epidemics in those settings. So it usually requires that sort of close contact. It's felt, it's felt by CDC that the type of contact required is probably a low risk for a sustained transmission to happen in the United States.
And one question I got from somebody, they asked me, is this airborne? And to our knowledge?
Yeah, to our knowledge, in natural settings, human-to-human transmission being airborne, it's felt to not happen, or if it does, it's exceedingly rare. Having said that, it's still recommended if someone's working with someone who has suspected Ebola, they should wear respiratory protection, a mask that's similar to what you'd wear around a TB patient. You can generate infectious aerosols, like in laboratory experiments with animals. They have generated infectious aerosols, and the virus has been transmitted that way, but that's an artificial setup. So.
One question I got from a mom, she wanted to know, does the virus affect children the same way it affects adults?
As far as I know, it does. I'm not aware of any predilection for adults or children or protection of one or the other. I think anybody is vulnerable to getting it.
And people want to know, what are the symptoms? Like, how long is the incubation period from exposure to when you start showing symptoms, and what are the symptoms?
Typical incubation period is about 5 to 10 days following exposure. It can probably be as short as 3 days and as long as 21 days. The symptoms typically come on quite abruptly with fever, body ache, headache, nausea, vomiting, diarrhea, but the person becomes very ill, prostration, they're just very, very weak and unable to do much. And then what happens is they start to get, their organs start to shut down. They go into circulatory collapse. They may go into kidney failure, liver failure. And something which happens in these, which kind of give them the name hemorrhagic fever, is that the clotting cascade is disrupted. They go into something called DIC, where they start clotting and bleeding. And they can bleed from their mucous membranes, from the nose, from the mouth, the GI tract. Any IV sites may start oozing, and blood vessels get leaky, and which furthers that. So that's why they're called hemorrhagic fevers, because not all of them, but a certain percentage of them, they will start getting these bleeding manifestations.
In the early stages, when it's just the fever and some of the things, it can kind of mock a severe case of the flu. How hard is it to determine Ebola virus versus a severe case of the flu?
Well, I think, first of all, you want to make sure you have the right epidemiology. In other words, the person has been to an area of the world where the disease is right now endemic, and right now that's 3 countries. That's Sierra Leone, Liberia, and Guinea. So if somebody's returning from one of those places and has a febrile illness, it should be thought of. It should be considered. Influenza has very predominant respiratory symptoms: cough, chest congestion, runny nose, like that. Ebola really, although there may be some very slight cough or some slight pulmonary symptoms, it's not a predominant symptom. But other diseases like malaria, other febrile illnesses, other febrile viral illnesses, definitely could be in the differential diagnosis.
What is the predominant symptom in Ebola? What would you look for?
Well, the early ones are going to be high fever, body ache, headache, nausea, vomiting. Many patients complain of a sore throat. They may have even some lesions in the back of their throat. And then severe prostration, like they're just knocked out. They just, very, very ill. Many patients will get a rash, and that's one of the things that is relatively common in Ebola. But then when the system starts shutting down, they start going into shock. The bleeding, that comes in at a point of the illness as well.
Some people might think, I know some friends of mine that were on a mission trip to Africa. They just got back. I need to completely avoid anyone who's been overseas. What do we do to keep that fear down and kind of quell that panic? And we don't want to encourage any kind of panic symptoms.
Mm-hmm. Well, I think, the CDC is closely monitoring that. There have been, as you know, a man got on a plane, traveled from, I think, Liberia to Lagos, Nigeria, and they're monitoring the people who were on the plane with him, watching for signs and symptoms. The risk of this transmission without risk factors for being around the disease or having any of those other risk factors for being around, blood and body fluids of people at risk of the disease make the likelihood of somebody getting it very low.
So just a casual encounter with somebody who'd been to one of those places isn't going to mean you're going to get it. You have to be
right.
A serious amount of time.
Right, and the virus is only infectious if the person is sick. So someone is not an asymptomatic carrier. So if somebody came from that part of the world and has no symptoms, they're not infectious for Ebola. The people who are infectious for it are sick with the disease, actively ill.
Somebody asked me if there's a cure or is there a test? Is there something that they can do to test to find out if they have it?
Mm-hmm. Well, the test would be, right now the testing is reserved for very specialized laboratories. Antibody tests are not typically effective, and what we rely on is either PCR or a virus culture. Those are being done at the CDC, and because it's a high level category of pathogen, it has to be handled in a special level 4 laboratory. So all those samples are going to be done at the CDC, checking for PCR or culture. As far as a cure, there's no specific cure that clearly works. However, very good supportive care, like IV fluids, attention to electrolytes, sometimes medicines can be given to try to modulate the clotting system a little bit to interrupt that whole bleeding process. Those are things that we have readily available in American hospitals, and so those will do a lot to help. But as far as a specific antiviral drug, they don't have that yet. There's people working on them. There's some small experiments with that, with a vaccine, but nothing that's ready for any real usage yet.
In your mind, the likelihood of an outbreak here in the U.S., now that we've got a few patients here, that are being studied in a very safe environment. But at the same time, there's people traveling all the time to and from countries that have these types of infections, whether it's Ebola, whether it's malaria, whether it's chikungunya, whatever it may be, or some new virus we've never seen yet. The likelihood of some sort of outbreak here in the U.S.
Yeah. I think it's very low. I mean, the CDC has definitely taken a stance that they think it's very low. They have done a lot of careful investigations of the contacts and the type of exposures that people got in those situations, in those outbreaks that happened in different African settings. And they feel that those types of situations would be very different than in the United States. And it's felt that it would not be conducive to sustain an epidemic here.
Yeah, y'all covered everything I could think of.
Thinking of, there was here.
Quarantine.
How long does someone have to stay in quarantine if you think they may have symptoms? If they think they may have maybe coming down with it, how long do they have to stay in quarantine before they're cleared and they can go about their merry way?
So certainly if you have someone who you suspect may have Ebola, you would want to make sure they don't before you release them from any quarantine. So the appropriate specimen would need to be sent to the CDC. They would need to perform the test, and they would need to say that the test is negative, the person does not have it. If someone has Ebola, then you would want to wait until the symptoms have resolved, and then there's even special instructions to people because sometimes virus can persist even for like a couple months or even 3 months in certain body fluids, and so they would have special instructions for that person.
What is the general fatal percentage?
So if you look at the different Ebola outbreaks, and there's different strains, I think there's 5 different strains. Each one has a different case fatality rate. The worst one is actually the one that's going on right now, which is labeled Zaire Ebola virus. In the initial outbreak in 1976, there was a 90% case fatality rate. However, in this current outbreak, the case fatality rate is about 60%. And probably a lot of that is related to earlier detection, aggressive treatments, like these supportive treatments that I mentioned, like fluids and electrolyte repletions and that sort of thing. So that right now it's at about a 60% case fatality rate.
So we're actually able to kind of stave off the fatality.
Definitely, yeah.
Is it more widespread today than it was in '76 when we first saw the Ebola virus?
Yeah, this outbreak that's been going on since March is by far and away the biggest outbreak that's happened since the virus was ever discovered. In fact, this outbreak probably has close to as much cases as all the other ones combined, and it's been sustained. The previous pattern of it appearing in a rural area and disappearing after like 1 or 2 rounds of infection, this one's just kept going and kept going. It's perpetuated, so this is unique.
Any reason why?
I think I can't completely answer that question. I think it's probably because infected individuals were more access to cities or bigger areas where the spread could continue. I think that's probably a big part of it.
So is it more like people are more migratory now, like where they go from city to city to city and they travel more and it's causing more of the spread?
Yeah, I would say something that seems to be it.
Does it have anything to do with the mutation of the viral agent?
Yeah, it's a great question. I don't know have they sequenced this virus yet and compared it to the sequences of the previous Zaire strain of the Ebola. But that's a great question, and it should be done. I'm sure they're doing it, and they'll compare if there's any mutations.
Does it have anything to do with maybe the migratory patterns of like the bats and the birds and the mammals that are carrying it at all?
That's another great question. That's certainly possible. I don't know if that's felt to be the case, but I'm sure they'd be looking into that.
I'll listen to a curious journalist.
Y'all sit in chat for just a second. Cut it off.
How long have you been working with the health department?
Well, in the job I'm in now, a little over a year, but I've actually been working here about 15 years. So before I was doing mostly tuberculosis, but now I'm doing